Hi everyone, so today we're going to be talking about influenza for our community group project, and some of the things that we're going to be discussing in this YouTube video is the prevalence of the illness in the community, some symptoms, risk factors, preventative measures, as well as health resources that we have found for the San Joaquin County. So that's what we're going to be talking about, and let's get started. So what is influenza? Influenza is most commonly known as the flu, and it's a contagious viral respiratory illness that infects the nose, the throat, and the lungs. And it's usually transmitted from person to person through droplets, and this usually happens from either coughing, sneezing, and talking. Influenza can cause either mild to very severe symptoms, and sometimes the severe symptoms do cause death. And that's why it's really important as a preventative measure to receive the influenza vaccine so that if you do happen to get influenza, your symptoms are more mild. The most common type or strain of influenza is influenza A and B, and these strains do usually cause the seasonal epidemic of the flu. And the flu season usually takes place from either late September to early October, and either to late March to early April. So these are some kind of the important things to know about influenza, and we'll be continuing talking more as we delve deeper into the slides. In this slide, we're going to be talking about objectives for a community such as the San Joaquin County with limited resources. So I think the most important is to take advantage of free resources that provide the influenza vaccines. There are a plethora of places that will allow you to get the influenza vaccine free of charge. If you don't have insurance, you still can get it. And we're going to be talking about more of those health resources later in the slide. But I do think that is one of the main things that we can be taking advantage of, especially with the community with limited resources. Also, as part of that you should be receiving the vaccine on a yearly basis, because the influenza strain does change, and they do change their vaccine to be most up to date. So it is important in order to combat influenza is to receive that vaccine yearly. Some things that we can also do that we should always be doing: continually washing your hands, and staying away from people that are sick. That's the best way to prevent the spread of diseases. Continually washing your hands, staying away from those people that are sick. And also specifically with influenza is understanding the signs and symptoms so that you better have a better understanding of what is happening to your body. And as well, if you're not feeling well, to stay at home. That's how we can best mitigate the spread of disease, especially influenza. So these are some of the objectives that I think that we can use as a community to better help combat influenza. So now we're going to be talking about the prevalence of influenza. Influenza is one of the most common diseases in the United States. Usually between about 3% and 11% of the people in the United States get it each year. And the CDC states that it's estimated about 35 million people are symptomatic for influenza. Now, specifically, the numbers do increase in communities with limited number of resources, as well as in third world countries. And this is primarily has to do with vaccination numbers. Specifically for the San Joaquin County, since 2019, there have only been 12 deaths related to influenza. And in California, as of 2021, there have been a lot lower cases. And it states that there is a more slow decline. However, there are still sporadic cases present. And overall, it is still recommended to receive the vaccine, and that is the best way to mitigate the spread of influenza.
Symptoms of influenza includes cough that often becomes severe, extreme exhaustion, fatigue for several weeks, headache, high fever, and body aches that last for 3 to 5 days. However, cough and fatigue may last 2 weeks or more, runny or stuffy nose, severe aches and pains, sneezing, and sometimes a sore throat. Children may commonly manifest vomiting and diarrhea. Anyone can get flu, even healthy people, and serious complications can happen at any age. But some people are at high risk of developing serious flu-related complications, and these are young children that are less than 5 years old, adults that are greater than 65 years old, residents of nursing homes and other long-term care facilities, pregnant women and women up to 2 weeks after giving birth. Also, those who have weakened immune system, people who have chronic illness such as asthma, kidney disease, heart disease, liver disease, and diabetes mellitus, and those who are obese with a BMI of 40. Preventive measures for influenza include avoiding close contact. We should avoid close contact with people who are sick. So when you're sick, keep your distance from others to protect them from getting sick too. Next, stay home when you are sick. If possible, stay home from work, school, and errands when you are sick. This will help prevent spreading your illness to others. Third, cover your mouth and nose. Cover your mouth and nose with a tissue when coughing or sneezing. It may prevent those around you from getting sick, because flu viruses spread mainly by droplets made when people with flu cough, sneeze, or talk. Next, clean your hands. Washing is important because it will help protect you from germs. If soap and water are not available, use an alcohol-based hand rub. Another preventative measure is avoid touching your eyes, nose, or mouth. Germs can be spread when a person touches something that is contaminated with germs and then touches his eyes, nose, or mouth. And lastly, practice other good health habits. Clean and disinfect frequently touch surfaces at home, work, or school, especially when someone is ill. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious foods. Flu is a contagious respiratory illness that is caused by influenza virus, and it spreads by tiny droplets when people talk, sneeze, or cough. Flu is different from colds. Anyone can get flu at any age, but some people are at high risk of developing serious flu complications if they get sick. And this includes greater than 65 years old or less than 5 years old, those who have chronic medical conditions like asthma, diabetes, heart disease, liver disease, and pregnant women. So the best way to prevent flu is to get flu vaccine each year. And if the doctor prescribes flu medicine, then you should take it.
Some health resources include facilities where you can receive the influenza vaccine. Influenza vaccine immunizations are available at local drugstores, including Walgreens, CVS, and Rite Aid. Flu shots are free with most insurances. Many health departments and free clinics offer low-cost or free flu shots across the United States. Out-of-pocket costs for those without insurance can range from $15 to $70, depending on the vaccines available to your age and health status. Another facility is the San Joaquin County Public Health Center, and the location is given where you are able to get a free flu shot. If you are a college student at San Joaquin Delta College, there is a health center located in Lock Lounge. On Mondays from 8 a.m. to 1 p.m. and Fridays from 8 a.m. to 5 p.m., immunizations, including the influenza vaccine, are free and available to Delta College students. The Center for Disease Control and Prevention seasonal flu vaccination campaign materials are available to assist partners in communicating about the importance of vaccination. Messages can be communicated to the public in many forms, through mass media, social networks, or simple methods like print material or infographics like the one on the slide provided by the CDC that says, "Mask up, lather up, and sleeve up," promoting the steps to prevent the spread of influenza. Social media resources you can use to share why you get an annual flu vaccine, which then promotes community awareness and prevention. National Awareness Week is December 5th through December 11th, and this focuses on highlighting the importance of flu vaccination. Influenza is a topic identified by Healthy People 2020 in their objective IID-12. This objective states, increase the percentage of children and adults who are vaccinated annually against seasonal influenza. This objective further includes people who are in long-term care facilities, those who are in nursing homes, healthcare personnel, and pregnant women.